Bianca is a 44-year-old woman who has had a stage 2 melanoma removed. Upon diagnosis, she was referred to the melanoma unit at the Alfred Hospital. After having a sentinel lymph node biopsy, she received a negative result. She has no identified residual cancer present. Hi Bianca, it's nice to see you again.
It's nice to see you too, Christy.
I've been receiving all your documentation from the Alfred Hospital and from your surgeon. How are you recovering?
Pretty well. The scar still feels a bit strange when I move certain ways, but it seems to be getting better.
The scar takes at least 2 years to fully mature, and in this time it's quite normal for it to feel tight or to pull when you move a certain way. Massaging the scar with moisturiser is a really good way to help it feel better too.
Oh yeah, okay.
I wanted to start by asking, does everything make sense about what's happened so far in your cancer journey?
Yeah, sort of. There's a lot of information.
Well, the Alfred have sent a really good summary of your treatment to date. I'll print off a copy if you like, because it contains all of your important results from the surgery and the lymph node biopsy.
That would be great. I'm still a bit confused what the lymph test means and what happens now. They did tell me, but it's a lot of information to take in, and I was so nervous going to those appointments at the hospital.
Well, let's summarise things and see if that helps. Last January, during your regular skin check, I saw a spot on your back that looked suspicious. We arranged to have it removed completely, and the result came back that it was a stage 2, 1.2mm thick melanoma. Because of the thickness being more than a millimetre, I referred you to the melanoma unit at the Alfred so that you could be managed by the team of specialists there. And also because it was stage 2, as well as removing the melanoma with that wider margin, they conducted a sentinel lymph node biopsy to get more information about the likelihood that the melanoma had spread. Fortunately, yours was negative, so it's really unlikely your melanoma has or will spread to other parts of the body. Does that make sense so far?
Yes, it does. So if it was positive, they would have recommended to remove some of the lymph nodes?
That's correct, and that would have been a much bigger surgery than what you've had to have.
So how often do I need to have my skin checked now? I'm just so suspicious of all my spots now.
Lots of people like yourself who've had a melanoma removed or a big cancer scare feel stressed or anxious about the thought of more cancer. Is there one part of having had the cancer or the journey so far that scares you the most?
Probably just the stress that it put on my family. I mean, I just want to be there for them. I know that it was removed, but if it wasn't detected, it could have grown into something much worse. It could have even killed me.
It must have been such a hard time for you all. How often would you say you worry about the possibility of it coming back?
I guess once a day or so. I mean, it only pops into my head every now and then. It doesn't stay a long time, and then it just goes.
I'm glad to hear that it doesn't linger for too long. Have you found there's any particular triggers or situations that seem to bring up the worries?
Well, I guess it pops into my head when I'm getting dressed or undressed and I see my body and I think about the moles and the freckles on me and I think, are they changing? I felt a bit nervous coming here today too.
That's very understandable. It's been a really big shock to you, so feeling nervous about your follow-up appointments is quite normal at this stage. Have you thought about talking to your husband Chris about these worries or talking to a close friend?
Oh, I don't want to talk to Chris. I don't want to burden him with my worries and he's so busy with work at the moment.
It could be really helpful. He might be worried about you, or he might have similar worries himself. Together you might be able to work out how to cope with these stresses or work out different solutions. Worry can sometimes make fears worse, and talking out loud with close friends or family is a really good way of getting things off your chest.
Yeah, all right. He does ask me if I'm all right, and I don't say much. We are going away next weekend, just the two of us, so Maybe I could say something to him then.
I think that would be a really good idea, and it does sound like the perfect time. Another thing I'm going to give you is a link to the WeCan website, which is here. It's got some really great links to resources to help people manage with the day-to-day impact of surviving cancer. So it has links to the Cancer Council, Melanoma Patients Australia and the Melanoma Institute, and there's lots of information there. And one useful thing is, if you're interested, you can be put in touch with people who've been through the exact type of melanoma that you have.
Okay, I'll have a look at it. It'll be nice to talk to someone who feels exactly the same way as I have.
I think it would be a really good idea, and I'd be really interested in your feedback as to how you find the experience. Back to your earlier question about how often we need to catch up. In the first 2 years, I'll be checking you quite regularly, every 3 months. Then, if there are no problems, these intervals will start to increase. But before we increase the time between any visits, I'll check in with how you're feeling to see if you're comfortable to do so. The best approach is to continue to check your skin regularly yourself, and you can use that online video link I showed you to remind you what to do. Have your regular follow-ups here, and protect your skin from the sun as best you can.
Okay, that does sound good. I came in here feeling so nervous, and just talking with you about this, I feel a lot better. And we've got a plan in place too.
Bianca, it's very normal to have these kind of worries at this stage, and most people find that they do ease with time. But if ever you feel like these worries are getting really frequent, please come and see me. I'm here to help.
Yeah, thanks Christy. It really means a lot. And I'll see you in 3 months.
Sounds good. I'll see you then. My name is Dr. Christy Edwards. I'm a GP subspecialising in skin cancer. In this video, we saw the GP acknowledging the patient had some fear of cancer recurrence. Fear of cancer recurrence is defined as the fear, worry or concern relating to the possibility that cancer will come back or progress. This can be prevalent in up to 70% of all skin cancer survivors, including those with melanoma and those with advanced disease. It is the most commonly reported unmet need in Australian cancer survivors. Fear of cancer recurrence is associated with both excessive utilisation of health services, such as excessive requests for scans, and at the other end of the spectrum, poor compliance with follow-up care. Characteristics of fear of cancer recurrence involve constant and intrusive thoughts, worries and ruminations about the cancer, hypervigilance to physical symptoms, the avoidance of or excessive levels of symptom checking and screening, interference with daily functioning, and can also be associated with distress, anxiety, increased symptoms of depression, and overall lower quality of life. Friends, family, and doctors often provide reassurance, which can discourage patients from expressing their true fears or concerns. Patients may also worry that they seem ungrateful if they express these concerns to their medical teams. This module provides GPs with the opportunity to reflect on their current practice of managing cancer patients and to consider new approaches and strategies that can reduce their fear, anxiety, and stress associated with surviving cancer. It is important to keep in mind that mild to moderate levels of stress anxiety is normal for patients who have had curative treatment for melanoma. However, a patient who is experiencing high levels of stress due to concerns about cancer coming back may need to be referred to a psychologist. When exploring the foundation of the patient's fears, some common fears patients may have about cancer coming back include needing further treatment or surgery, physical disfigurement caused by surgery, more life disruptions, the possibility of death, further pain or disability, how another cancer diagnosis may affect family and friends, financial strain and further time off work, potentially putting their job at risk. Words, sights, sounds, and even tastes and smells can bring on fears. Sometimes the patients are aware that a trigger is looming, and other times triggers can appear quickly and can take the patient by surprise. Some common triggers for patients who have had treatment for cancer and have a fear of cancer coming back are special occasions such as birthdays, holidays, or medical anniversaries, another person's cancer diagnosis, passing by a hospital where treatment was administered, death of a friend or family member, hearing media reports about cancer or new treatments that are being trialled, or celebrities who have recently been diagnosed with cancer, cancer fundraising campaigns or health warning advertisements, such as those about skin cancer and melanoma, follow-up appointments, tests, scans, and medical appointments, unexplained physical symptoms or changes in health, ongoing effects of treatment or use of medications, and discussion about stopping treatment. The triggers highlighted in dark blue may be the cause of anxiety and fear that patients are experiencing whilst visiting the doctor. Scanxiety is a feeling of terror and dread that one experiences either pre-scan, during and post-scan, and while waiting for results. Scans or medical appointments can be associated with trauma of a diagnosis, fear of the cancer returning or progressing, a change in therapeutic approach, and discomfort and confinement of having a scan. So how do we know if a patient has a fear of cancer recurrence? Quite often, a GP may be consulting a patient about a topic or issue, and the patient is feeling anxious without the GP knowing. A patient may provide subtle clues or hints indicating an underlying emotion. So what is a cue? It can be a verbal or non-verbal, and it is a hint that the patient may have concerns and issues about cancer recurrence. Some examples of verbal cues could be, what if it comes back? I know that I finished treatment and the cancer is gone, but I'm still feeling flat. I'm so suspicious of all my moles now. So in addition to the GP listening to what their patient is saying, sometimes hints about an underlying fear could be a change in their behaviour. Patients may incidentally refer to the behavioural change, or a family member may express their concern for the loved one who is recovering from cancer. Behavioural change that is a cause for concern includes checking their body for signs of cancer much more frequently than the treating team recommends, avoiding any sun exposure because of worries about getting a new melanoma, to the point where they cannot do the things that are important to them, spending excessive amounts of time researching or Googling types of cancer and treatment options, weighing themselves very often, becoming very fixed with diet and exercise routines, not going to medical appointments or scans because of thoughts that they have signs of cancer returning or progressing. Evidence for fear of cancer recurrence interventions delivered by nurses supports the use of the following strategies: patient-centred assessment of fears, normalising and validating fears, encourage expression of fears, such as what scares you the most about the cancer journey, relaxation strategies, for example, diaphragmatic breathing or progressive muscle relaxation, and setting goals to reduce symptom checking. So how do you assess a person's level of fear? Assess for intensity and content of fear of cancer recurrence thoughts and images, onset and triggers. Assess the frequency, how many times per day, how many times per week, how long they last. Behavioural changes, for example, avoidance of thoughts, images, attempts to control or get rid of it, excessive symptom checking, and avoiding medical appointments. Assess the emotional impact on the patient. Also assess the functional impact on day-to-day activities. Here are some strategies to consider and offer to patients to help manage their anxiety and stress caused by fear of cancer recurrence. As mentioned earlier, relaxation exercises, mindfulness techniques, and guided meditation are evidence-based strategies. Deep breathing can be very effective in managing acute symptoms. Encourage patients to recognise their feelings. Encourage them to try and identify the type of fear and what are their triggers. Encourage the patient to talk about it with family and friends and to identify who their support network is, who they can call when they are feeling overcome with fear. Encourage them not to ignore their fears. Accept that it's normal to experience a level of fear and focus on managing the anxiety. Also encourage them not to worry alone, to join a support group. Some of these support services are covered in another chapter. Discuss strategies for reducing stress. This might be socialising with friends, hobbies, exercising, getting outdoors, even taking a bath, reading a funny book, watch a movie, that type of thing. Make sure to inform your patient about cancer recurrence and make sure they know what symptoms to look out for and discuss a follow-up plan if these do occur. Discuss healthy lifestyle choices, exercising regularly, maintaining a healthy diet, limiting alcohol, ceasing smoking, and developing healthy sleep routines. So in summary of what GPs and their clinic staff can do to help identify, manage and support patients with fear of cancer recurrence, you can assess fear in all people living with or beyond cancer, as covered earlier. Encourage expression of fears, normalise and validate these concerns. Encourage regular relaxation strategies. Assess if the patient is engaged in excessive symptom monitoring, behaviours, or avoiding follow-up, and set goals to adhere to recommended follow-up care. Schedule appointments for results as soon as possible after tests come back. And finally, refer to psychologists experienced in working with fear of cancer recurrence to manage patients with clinically significant levels of fear and associated anxiety. I would like to acknowledge and thank both Dr. Fiona Lynch and Dr. Maria Furtanu for their insights and efforts in supporting the development of this melanoma practice coaching module. Their participation is greatly appreciated and their insights are of significant value to the management of patients who have experienced melanoma.